Simpson's rule is an alternative method of calculating ejection fraction used to double-check a low ejection fraction calculated by the Tychols method. It is based on the actual change in volume of the human left ventricular chamber. It can be applied to veterinary medicine even if it is not exactly accurate for dog and cat hearts. In human cardiology, a left apical 4-chamber view and a left apical 2-chamber view are used. In veterinary medicine, use the left apical 4-chamber view or the right side long axis 4-chamber view of the left ventricle. Observe several heartbeats and press the freeze button. Cinematic loop is used to select the image from the right side long axis 4-chamber view showing the largest left ventricular size, or in diastole. Activate the calculations package and select a volume measurement for 4-chamber diastole of the left ventricle. The first caliper is placed on one side of the mitral annulus, and the endocardial surface of the left ventricle is traced to the other side of the mitral annulus. Press Select and use the trackball or touchpad to adjust the cursor at the apex. The ultrasound machine divides the ventricle into a number of discs and calculates the volume. Save this measurement. Use Cinematic Loop to select an image showing the smallest left ventricular size, or in systole. Activate the calculations package and select a volume measurement for 4-chamber systole of the left ventricle. Trace the endocardial surface as before and press Select. Use the trackball or touchpad to adjust the cursor at the apex and save the measurement. In veterinary medicine, this single view will suffice. The normal ejection fraction for dogs is 60 to 80%. For cats, it is 70 to 90%. The Tychols calculation for ejection fraction is valid only at the M-mode cursor line. In normal patients, ejection fraction calculated by the Tychols method and Simpson's rule agree closely. If damaged heart muscle results in poor contractility at the M-mode cursor line, other cardiac muscle may compensate by overcontracting, and the actual ejection fraction will not change. If an ejection fraction by the Tychols method is low, the measurement can be repeated by Simpson's rule to confirm the result. This is important when Tychols measurements suggest dilated cardiomyopathy. In a normal animal, the septum thickens and becomes thinner with systole and diastole, but remains in the same relative position on the ultrasound screen. Paradoxic septal wall motion is a downward movement of the septum during diastole. This occurs most frequently when right side diastolic pressure exceeds left side pressure with moderate to severe right ventricular volume overload. As left ventricular pressure increases just before systole, there is a sharp upward movement of the septum, right at the point where you normally make diastolic measurements for fractional shortening and ejection fraction. These paradoxic movements of the septum invalidate the fractional shortening and ejection fraction calculations. Paradoxic septal wall motion may also be seen with regional infarction, left bundle branch block, aortic insufficiency, mitral stenosis, and pericarditis. Simpson's rule can be used to verify ejection fraction in such cases. This 3-year-old Doberman has a severe pulmonary insufficiency causing a severe right ventricular enlargement. There is also advanced severe mitral insufficiency. Because of paradoxic septal wall motion, left ventricular fractional shortening is low normal at 28%, and ejection fraction is slightly below normal at 56%. A left apical Simpson's rule measurement shows an ejection fraction of 71%. Although the ejection fraction by Simpson's rule is better, it is still in the normal range, indicating myocardial failure in this Doberman with pulmonary insufficiency and severe left atrial enlargement due to mitral valve disease.